Welcome back. Well, doctors offer many treatment options to cure what ails us, but what if the doctor became the patient and had those same surgeries done on him?
A little different perspective, but that's exactly what happened to Dr. Muthan Kendula from Advanced Ear, Nose, and Throat Specialist. He's had the same surgical sinus procedures that he often performs on his patients, and today we're going to talk specifically about tonsillectomies, which I think is great. So how are you feeling overall?
Great. Couldn't be better.
Really?
You know, it's sort of, we were talking about a little bit before, is that, you never really know what you're going to get on the back end. And it's been about 3 months now, and it's been everything and more. So, I see it every day. So I see my patients, and they go through the surgeries and things, and they get on the back end. And for the most part, it's pretty, most folks notice a lot more changes than they thought they were going to notice coming into things. And now I'm on that same, bandwagon, basically.
Yes, now you can recommend it and really know what you're talking about.
Yeah, absolutely.
Yeah.
Absolutely. Yeah.
And I know you've said before, it really takes, having symptoms for a long time and knowing that you can't treat them other ways to determine why to do all these. And you did a bunch of different surgeries, like all at once.
Right. Yeah, I mean, for me, it was just kind of trying to find the time. Everybody's busy. I mean, there's better things to do than, have a nose and tonsil surgery. But the time comes where you kind of have to cut your losses, and that's kind of how I looked at it. For me, it was, a lot of nasal blockage issues, just annoying stuff. And then with my throat, it was a lot of just chronic sore throats. I never really had real active tonsil infections, but it was just chronic irritation. And a lot of folks don't know what's going on with that, and I did, because I do what I do. But so it was just chronic irritations, chronic sore throats. I had deep pockets in my tonsils, which lead to a little buildup there. It's just annoying sort of stuff. So at some point, you either say, I'm just going to live with this, that's fine, I'm going to deal with it, or you cut your losses, and that's what I decided to do.
And you had a tonsillectomy. I think a lot of people think of tonsillectomies as being a procedure that's most commonly performed on kids.
Yeah, it usually is. And, folks, I turned 40 this year. Folks in my generation, it kind of, when we were little kids, it kind of went out of vogue as far as getting your tonsils out. And so a lot of folks that I see these days in my age group have, missed the boat when they were kiddos, have got these ongoing chronic issues, and, boy, now is the time we have to deal with it. And it's less fun. It's never fun for anybody, but it's less fun as an adult to have your tonsils out than it is as a kid. But again, it's more a matter of, what's your alternative, and I decided it was time. So,
How have they changed over the years? How have tonsillectomies, changed, I guess, as a surgery?
Quite a bit. I mean, so the way we do it and the way I had it done is something called coblation, which what that does, we're able to remove the tonsils without creating a lot of heat. So back in the day, what ended up happening is we created a lot of heat, which burned the healthy tissue. And so in addition to having a raw area that needs to heal up, it's a burned area, so that we can avoid that. And so for me, it was sore on the back end, but because we didn't have to deal with that secondary, sort of trauma, it wasn't as bad as I thought it was going to be. In fact, it was a lot better than I thought it was going to be. I didn't take any prescription pain medicine the whole way through. I forced myself to eat things day of, and they're coming out of the gates. And so, again, it wasn't any fun. It certainly was tolerable, a lot better than I thought it was going to be. And on the back end of that, now living day to day with not having to deal with this annoying, stuff is a good thing.
So when your patients complain about it, you can go, "That's not that big."
Well, I try not to
Ice
judge.
cream.
I try not to judge.
What about, a lot of people who've had the kinds of sinus procedures that you've had in tonsillectomy will say, "Oh, I can breathe so much better while they're awake." What about sleeping? Have you noticed any improvements there?
Sleep-wise, it's pretty dramatic. I mean, I definitely, no question about it. I mean, I wasn't a horrible sleeper beforehand, and so you never know kind of what could the changes be. But I sleep soundly at night. Before surgery, it was a lot of. I woke up a few times at night with just blockage. You can't breathe. You got to switch positions, that sort of stuff. But oftentimes, just interrupted sleep throughout the night. And so one of the weird things that happened started happening a couple weeks after surgery was that my dream content wasn't able to meet the demand, basically. And so, I was used to waking up, it's hard to say, but maybe every half hour you kind of shift positions. And when you can sleep soundly well, breathing through your nose, I would get to the end of a normal dream. So think of Indiana Jones, a big action sequence going on. You get to the end and it just stops, and all the actors just sort of stand there and are staring around for about, it just seems like it goes on. And then sometimes I'd wake up because it was so boring that I have to, enough of this kind of thing.
So the characters in your dream, it's like you would have.
They were used to. They had their segment length, and my leg limit was extending beyond it, and that still happens. So it's that's a pretty good. I never heard that explanation from a patient, but from me, it's true, and it's just a weird, a weird but yet poignant explanation of or depiction of the fact that I am sleeping longer, sleeping more soundly.
Sleeping that much better. It's
Weird.
wild. The characters in his dream, they're done with doing what they're going to do, and they're
They don't
like,
know
come
what to
on.
do next.
Let's
You're
wake
still
up now.
sleeping.
Yep.
Let's finish the
Exactly. Get on
plot.
with it.
What's
Exactly.
happening?
Yeah.
Well, that makes a good point. I mean, a lot of the surgeries you had, tonsillectomy and all that, for you, they weren't life-threatening.
No.
So I think it brings up an important point of that, the fact that consumers need to be educated, whether or not it's something serious or just completely, just changes the way they can breathe.
Sure.
It's something they really need to be educated
Well, yeah,
about.
I mean,
though,
you
right?
got to think about it, and it's not like having your appendix out. When you have to have your appendix out, you got to have it out. There's no when you have a heart attack and you have there's no issues or no question about that. With the stuff that I deal with, it's all quality of life issues for the most
Yeah.
part, and so you got to figure out, okay, is this affecting my quality of life? If it is, then what am I going to do about it? And what you need to do about it is get it checked out. Now then you've got the decision. If you've got some anatomic issues that need to be corrected, so be it. I mean, if that seems to be the right fit for you, if you say, okay, I understand my problem, I'm not going to go that way, that's fine. But I think you at least owe it to yourself to kind of figure out what your options are. If it's an issue. If it's not an issue, then don't worry about it.
But I think that's the truth. You, like a lot of your patients, suffer for many years in many cases before finding help and seeking out some options. So I think it's good advice to look into it, because you might sleep so much better and breathe so much easier. So here's how you can get in touch with Advent. They're located on North Mayfair Road in Wauwatosa. The phone number to call for more information is 414-771-6780, and they're online at advent.md. Thanks so much.
Thank
Good
you.
stuff.
Yeah, thank
Thank you.
you. And still